Hello, football lovers and FIFA World Cup people. My name is Maupemo Ashon, and aside being a football lover, I'm a digital health and informatics specialist with a great interest for mass gatherings because of its public health concerns. In my professional work, I have supported the response and management of local and international disease outbreaks, including COVID-19, cholera, mpox, dengue fever, and the likes. As part of my interest for mass gathering, I went ahead to take a WHO course on COVID-19 mass gatherings risk assessment. Now, the World Cup. When the final whistle blows at the FIFA World Cup, what do you think millions of fans will take home with them? And what might they leave behind? And for countries like Japan, we know they leave nothing behind in terms of rubbish. Yes, that we are applauding them for that. But what will they take back to Tokyo and all the cities? And then what would they leave behind? Aside not leaving behind rubbish, what would a country like Japan that doesn't leave refuse or rubbish behind, what are they leaving behind? And what are they taking back home? Today, I would like us to look beyond the goals, trophies, celebrations, and so we can explore the public health dimension of the world's largest sporting event, the World Cup 2026. We will examine the current outbreak landscape among participating countries and then the health risks facing our host cities. The FIFA World Cup this year, 2026, brought together 48 countries, millions of supporters, thousands of athletes, and countless officials into 16 cities in 3 host nations. Every flight, every stadium, every hotel, fan zone, and public transport system becomes a point where people, cultures, and unfortunately diseases can meet and move. Mass gatherings like the World Cup 2026 do not create diseases. They simply create the opportunities for diseases to travel from one point to the other. Now, looking at the tournament, this year's tournament brought 48 countries together instead of the usual 32. There are 3 host countries: United States, Canada, Mexico. In these host countries, we have 16 cities hosting these matches. 18 of these participating countries have either reported a disease outbreak or they've heightened preparedness towards importation of diseases. 10 out of the 16 cities hosting the World Cup have outbreak relevance. They are dealing with one outbreak or the other. And all these 18 countries and 10 host cities, we are looking at 6 diseases. Now, diseases like Ebola, mpox, Rift Valley fever, cholera, measles, and chikungunya. These 6 diseases are what we are looking at. Every country by health status. So like I said, there are 48 countries, but 18 of them are with outbreaks or have alerts of outbreaks. DR Congo is dealing with Ebola as well as mpox, and this is reported on the WHO disease outbreak news. Ghana is dealing with mpox. Senegal is looking at Rift Valley fever. Haiti has a persistent transmission and risk of exportation of cholera. United States is dealing with measles, as well as Canada and Mexico are all dealing with measles, and this is reported by the CDC and state health departments. And the Power of Canada has also reported these measles. Now, Brazil in South America is dealing with chikungunya with a last reported case around before we did this report. These are the 18 countries with outbreaks or alerts. This constitutes 37.5% of the participating countries. Measles and the host nations. Now, United States, Canada, Mexico have reported measles concern or enhanced surveillance. And why are we looking at measles specifically for host countries? This is where everybody is going to be. This is where all the funds, all the activities are going to be. And if measles is here, it's of high interest. But why does it matter? It matters because measles is airborne. Measles is highly contagious and it spreads in crowded settings, although it's vaccine preventable. So for all the people who have been vaccinated, that's fine. But what about those who have not been vaccinated? The risk lies in 10 cities, but 10 out of 16 is a lot. That is 62.5%. That's a lot. So every city that is mentioned here has the potential of carrying a spread of measles from US, Canada, or Mexico to the other continents. Dallas, Houston, Miami, Philadelphia, San Francisco from the United States. We have Toronto and Vancouver in Canada, and then Monterrey, Mexico City, and Guadalajara in Mexico. These cities are linked with the measles activity. The 6 diseases we are looking at have 3 distinct threats. There are some that are most widespread, which is the mpox, is affecting 10 out of the 18 countries. And then the measles has high probability for a mass gathering threat. It's airborne, it's highly contagious, and it is in 10 out of the 16 cities hosting the World Cup. So the highest probability of spread is measles. And then Ebola, that's happening in DR Congo, has a severe impact, has the highest consequence, because we know out of research and studies about the fatality rate. So this is how the diseases look like: mpox, measles, chikungunya, Ebola, cholera, and Rift Valley. People are going to live infectious diseases because most of these diseases, if not from the participating countries, can be picked up from one host city and transmitted into another host city. So infectious diseases are going to be footprints that might be left behind. If we take infection prevention and control seriously, we might escape the transmissions. But with these kind of diverse cultures coming together, people from diverse countries, different cities, different backgrounds, it's highly possible that we might leave footprints of infectious diseases in the host nations, even in the host cities that have not reported any outbreaks. Possibly some of the host cities that have reported measles, we might leave something else behind. We might drop a cholera, or we might drop an mpox. For these host nations, host cities, would need to heighten their disease surveillance in terms of data collection. We will also leave behind cross-border public health collaboration. We will need it because even among the host cities, there needs to be a lot of feedback and reporting to be able to fight or respond in case there's an outbreak or in case there's a left behind infectious diseases. And then we'll be able to share a lot of health system lessons. Fans and players will always carry home the memories, the cultural exchange, the clubs, the parties, the street activities, the sporting experiences, stronger international collaborations. You see presidents meeting presidents, ministers meeting their like ministers, and then we would learn new public health practices. But aside that, most of what travels home with us would be some imported infections. There might be little out of all the fans that went to the United States or Canada or Mexico from, let's say, Africa. One person might import a measles case, and that could cause a problem for the entire continent, the entire country, and all. We know there are going to be positive experiences. We are going to take home a lot of positives. But imported infections make surveillance and vaccination a shared global responsibility. It's not going to be America should handle their measles by themselves, and Canada, Mexico should also handle their measles by themselves, but it's going to become a global shared responsibility. What have you seen? Are you conducting any contact tracing? And if somebody is reporting some sort of fever or signs and symptoms, is it related to the travel? So we need to have a lot of surveillance and vaccination. Mass gatherings do not create diseases. They create opportunities for diseases to travel. At the airports, diseases are not luggages. They are not physical. These are the hidden passengers that are going to move from airport to hotel to homes. The FIFA World Cup 2026 is a chance to celebrate football while strengthening disease surveillance, preparedness, and global health security across every host nation and participating country. Make sure in this period where some countries are being eliminated, meaning that the players or the athletes and their fans would go back to their continents and their countries, stay informed about outbreak news and also track your health. Every signs and symptoms you see shouldn't be taken lightly. Visit the nearest health facility and let the health worker know that you have been to the World Cup and these are the places you went. Get vaccinated if you've not been vaccinated. Most of the diseases that we saw are vaccine preventable. So get vaccinated, especially against measles, because you have most definitely been to a measles outbreak area. And then practice good hygiene. Protect yourself, protect your family, protect your colleagues at work. Whilst you show them all the pictures from the World Cup, protect them as well. Thank you.